Mr. President.
Senator from Alaska.
Mr. President, how much time is remaining on our side?
10.5 minutes.
Thank you, Mr. President. Mr. President, I too rise to speak very briefly on the Defense Appropriations Bill for FY10. I do appreciate all of the hard work that goes into formulation of this bill, and I commend the leaders of the Defense Appropriations Committee, Senator Inouye and Senator Cochran, on a very fine product. It's a product that does justice to the men and women who wear the uniform of our country in defense of peace and liberty, and it's a product that does right by our military families who we must never forget also serve. I just want to recognize this morning, share some comments about what this bill means for the fighting men and women in my state of Alaska. Alaska is home to about 21,000 men and women who serve on active duty. Add to that number approximately 4,700 members of the National Guard and the Reserves. The bill that is before us supports the soldiers of Fort Richardson, Fort Wainwright, Fort Greeley, the airmen of Elmendorf Air Force Base, Eielson Air Force Base, Clear Air Force Station, and 18 radar sites in remote rural areas of our state. We also have the Marine Detachment that's hosted by Elmendorf Air Force Base and Naval Special Warfare Center Detachment in Kodiak. It supports units big and small, units like the 4th Airborne Brigade Combat Team of the 25th Infantry Division based at Fort Richardson, which numbers in the thousands of troops. The 4th Airborne Brigade Combat Team is also known as the Spartans. This Spartan Brigade will be spending Christmas in Afghanistan. Also in Afghanistan this Christmas are 11 members of the Alaska Air National Guard 176th Wing who left Anchorage on November 5th after serving an early Christmas. We wish them all well during this holiday season. We are thinking about their families and we collectively pray for your safe return. Mr. President, I mentioned Christmas. We know that we are upon the holiday season here, although here in this chamber it certainly doesn't feel that way. There is no sense of giving and sharing and the general cooperation and cheeriness that comes, at least in my family, with the holiday season. I think we've also, as we approach the holidays, we think about what is going on throughout the country as we face an economic recession. Families are choosing to do differently this year. They're squeezing back on their family budgets. They're making some different choices, some hard choices. And I think it's fair to say, Mr. President, that folks are probably looking at us here in Congress and saying, well, we wish that they would be doing more of the same, making some of these hard choices when it comes to spending. And just to kind of put it into context in terms of what we've seen here in the Congress in the past week or so, it was last Sunday, just less than a week, that we passed a $1 trillion plus spending bill. These were 6 different appropriations bills. 3 of those 6 bills were not subject to Senate amendment and debate. We went above and beyond the regular order and produced an omnibus package. Again, was a package in excess of $1 trillion worth of spending, about a 12% increase over the year previous. Shortly before that, about a week prior to the action on the omnibus, the EPA, the Environmental Protection Agency, issued an endangerment finding. This endangerment finding, for those that have been following this issue, I think many recognize that the potential cost to this country, the burden, the financial burden that could be placed on this country if we advance through the regulatory process as opposed to the legislative process, these regulatory burdens, I think it is clear that the cost and the impact to this country and our nation's economy is truly in danger. So when we talk about an endangerment finding coming out of the EPA, it really is just that. It endangers our economy, it endangers jobs, it endangers the competitiveness of those of us here in this country. So again, people are looking at this and saying, well, what is going on in Washington, D.C.? Don't you realize that we need to be working to save and create jobs. We need to be doing those positive things that are helping us as a nation and economy, not those things regulatory or legislatively that would hurt us. And now, Mr. President, we are in the midst of trying to move through a health care bill in the final days before Christmas, a $2.5 trillion reform package that at this point in time we're not quite sure what's in it, but when it is revealed, it's possible that we will have about 36 hours to review this, to understand it, to appreciate the implications for us in our respective states, the impact to our economy. But again, one of the things that we do know about this is that the framework that we're operating off of is one that will increase taxes on the small businesses and the individuals in this country. It will cause cuts to Medicare at a level that are just incomprehensible, almost $500 billion. And for all that we can tell, it's going to increase premiums. So Alaskans are looking at this package and saying, this isn't the reform that we thought that Congress was going to be giving us. Following on the track of the spending, we're going to be discussing increasing the debt limit. Again, people in the rest of the country are wondering what's going on here in Washington, D.C. What's in the water that is causing you to spend at levels that are almost uncontrollable. And our reality is that it's not you and I that are going to be facing the financial consequences in the out years so much as our children. Mr. President, during the holiday season, I still have kids that I try to keep the presents secret. So I have a tendency to kind of rat hole them away, hide them. But I will tell you, the one thing that we cannot hide from our children this Christmas is the fact that what they will be receiving is an incredible debt. An incredible debt, and that's not a gift that we can afford to give our children. Mr. President, when it comes to discussion about the health care bill and the consequences of it, there's been a great number of journalists that have been opining and comments that have made, and we've certainly kept the presses busy with this. But there was an article in the Washington Post in the opinion page a couple days ago. This is from Michael Gerson, and he makes a statement that I would like to read. He states, "The entire Democratic health reform effort is foundering as its deep bow enters the shallow channel of fiscal reality. And that splash you hear is the sound of various groups being thrown from the ship to lighten the load. Instead of beginning with affordable, realistic objectives, President Obama and the Democratic Congress set the goal of guaranteed comprehensive coverage for everyone. This requires a lot more money in the system, which must come from somewhere, actually from someone." Then you go to an article that was in this morning's Hill magazine, and this one, the headline is Senate plan to tax health plans is bad policy. And the article starts off by saying this: "Millions of working Americans will pay thousands of dollars more in taxes under the Senate proposal that taxes health care benefits to finance reform. According to the CBO, this excise tax will affect 1 in 5 Americans. Millions more will have their health benefits cut and see their costs go up. This is the opposite of health care reform." Well, Mr. President, you might think that that was an article that I might have written or some of my Republican colleagues wrote. Actually, this article is penned by Jim Hoffa, who is the Teamsters General President, and Mr. Larry Cohen, who is the Communications Workers of the President of Communication Workers of America. So, Mr. President, my point in saying this is that as people understand more and more about what is contained within this healthcare legislation, they're coming to understand the impact to them and to their families. And they're quite anxious because they know that as the years go out, the costs The costs don't go down, the costs only go up. We're concerned in Alaska about access to care. I've stood on this floor many times and talked about how in Alaska we simply do not have the Medicare providers that we need to see the people in my state, particularly in our largest community. We just learned that one of the medical clinics in Anchorage has made an announcement, issued a letter to their patients. Northwest Medical has 4 practicing physicians that were seeing Medicare patients. Earlier this month, 3 of the 4 physicians opted out of Medicare, resulting in 550 Medicare beneficiaries being without a physician. So what's happening? They're calling us. They're calling us for a doctor's appointment. And the problem is that we can't get them in anywhere either. We've got one facility in Anchorage where they are taking new Medicare eligible individuals. When we did a count, the Institute of Economic Research did a count as to how many providers in Anchorage, Alaska, were taking new Medicare individuals. It was 13. Well, we heard from a provider just last week that she's opting out. These 3 make a total of 4. Mr. President, this is simply not sustainable. So for us as a Senate, for us as a Congress, to be moving forward in the name of health care reform, any provisions that will further jeopardize access to the people of Alaska or the people of rural America or all over this country, that we would do anything that would jeopardize their access is foolish. It makes no sense. We must stop this reform effort. We must do our job here in Congress to provide the people of my state, the people of all of our states, real health care reform that reduces the costs, provides for access, and does right by the American people. With that, Mr. President, I believe my time has expired, and I yield the floor.